Can I ask a difficult question?
Yes.
Sometimes when doctors or nurses or other health professionals are talking to people about an illness, we try very hard to use the right language. We try very hard to say the right thing. And I hope that more often than not, we manage to get it right. But do you have any experience of people somehow saying the wrong thing completely by accident?
I was going for my annual mammogram. I think it was 3 years after my first diagnosis, and initially they bring you in for a physical exam before you go for the mammogram. And the doctor that did my physical felt something and said, "Oh, I feel a lump. This isn't good. Send her for a mammogram right away." And there and then I nearly fainted on the table. He wasn't. I didn't find him very empathetic. He wasn't looking at me. He didn't even look at my face. He was just looking at the lump. Spoke to the nurse. "This isn't good. Send her for this." And that was scary. Thankfully, it turned out to be nothing, but that stuck with me. I found that hard.
So you felt that you were a bit of flesh on a table,
yeah,
and he was talking to somebody else about this specimen, please do something else.
exactly. Yes.
And he had great difficulty in looking at you and talking to you as a person.
He did, and he pushed and prodded, and it hurt. Now I started to cry, but it wasn't the pain; it was the fear when he was pushing, and he didn't acknowledge me as a person. He didn't ask me, "Was I okay?" The nurse came up to my side and caught my hand and squeezed my hand and looked at me, and I knew she was saying, "You'll be okay," but he didn't acknowledge me or my upset at all. There's one more thing I found this particular time when I went for my surgery. The following morning, when the consultant comes around with the junior doctors, I remember there was 5 of them, all males this particular day. They came into my room. I had my own room, and the consultant stood at the door, and the 5 of them literally gathered around the bed. Now I was still a bit out of it. I hadn't had a great sleep, and they came in and said, with their chart, "Hello, Audrey, could we have a look at your wound, please?" Just like that. And firstly, no one pulled the curtain, and secondly, there was 5 of them. Now I was comfortable with my scar. I had seen it the night previous, but I know for a lot of people, they can't look at it for weeks. They just can't face that physical side of it. It's upsetting. And I felt they didn't think about that, how this would be for me. There was 5, happened to be 5 males, which is a little more intimidating, standing around waiting for me to lift my gown so they could look at my scar. And it just wasn't very personal, and nobody asked my permission. "Would you mind?" It was, well, they did say, "Could you lift this and show me?" But I don't think they were thinking about how it would feel for me. I was vulnerable. I had just had surgery the day before, and it was a scar that was reminding me of everything that had happened and what was coming. And I felt that could have been dealt with better. The consultant did say, "Are you going to pull the curtain? Are you going to give her some privacy?" And I know they're training, but I certainly think the way they march into your room, you could be asleep there. It could just be a little more personal, I feel.
So when students or junior doctors examine you, you say that it could be more personal. If you were teaching them, and in a way this video is teaching them, what advice would you give them for the next patient that they see with that problem?
Firstly, I wouldn't come in the door and all stand around the bed looking down on top of you. I think to just come in, if one person sat down, said who they were, introduced themselves, asked you how you slept, how are you feeling today, how are things, and approached it just in a more kind manner. I felt on this particular day they were more concerned with what the consultant was, what they were being watched and they were being examined, they're in training, but they were more concerned with that than me in the bed.
That's interesting. So, and you say that they didn't really ask permission.
No.
how should they have asked? And I absolutely agree that we should always ask permission of the human race when we are thinking of examining or investigating. How would you suggest a student would ask permission after they've introduced themselves, treated you as a human, as a person? So it's person-to-person connection.
Yeah.
What sort of words, what sort of phrases, how would they ask permission?
Well, I think even by starting to say, have you seen your scar yet? This is the morning post-surgery. Have you seen it? How are you feeling about it? Are you okay for us to look at it? Have you looked at it yourself? Do you mind us looking? There's 5 of them. Would you prefer if it was just one? Something like that would be
Yes.
easier.
Yes.
Like, again, for me, I'm a bit tougher, and I was okay with it, but I couldn't but think of another person
Yes.
who might be very bothered and very upset by that.
And in a way, I suspect that it's still been an uncomfortable episode for you.
Oh, yeah.
However, you were able to deal with it, but it's something that you would prefer not to go through again.
No.
Okay. We often find that when people go for tests in hospital, whether it's a swab for a sore throat or whether it is a mammogram in case it's a cancer of the breast, that the investigators never give a possible answer to what the tests are showing, even though we kind of suspect that they've got a bit of a hunch. And you very clearly explained that your experience was that they wouldn't tell you a thing. By them not saying anything, did that reassure you?
No.
If we were to be able to change the world, how else do you think investigators, medical investigators, could communicate better with the individual who is being assessed?
I do believe that by giving an indication of what's to come, when in circumstances where they know, where it's looking clear what it is, to give an indication. I know it can't be 100% until results are back, would be beneficial, because you have that week usually, or I'm sure it varies, but at least a week for results of biopsies and for the biopsies. And I think that week is so tough. It's the toughest week, and to have time to let it sink in, even if it's only a little bit, it will still help when the blow comes on the day your results are given.
Thank you. When you saw your oncologist, he was giving you a lot of positive information the first time round, and then one piece of information which felt negative. It was the negative that you remember. Second time around, seeing your oncologist, what if your oncologist said, okay, Audrey, we know that the chances of survival are so many percent. We know that the chances are this or that or the other. We have a risk table. We can tell you what the likely risk is. Would you find that helpful, or would you prefer not to know until you've been through the treatment?
Not initially. Personally, I feel you're very vulnerable at the start. A second diagnosis, it knocks you much harder than the first. And I don't think statistics for me would be of any benefit. At the end of the day, everybody's different, and how you approach lifestyle changes and all of that, I think, can make a difference. And for that reason, I think statistics, they're dangerous. They're for your mental health. I don't think they will help, because your instinct is to go with them, and that's what you hold on to, and that's not what is going. That's not going to keep you positive. So I don't think, for me personally, they would be beneficial at this point.
So are you telling me that at 3 o'clock in the morning, when you wake up and you've got your laptop, you don't go on the web and sort of try and work things out?
No, I don't. I was told, day one, my nurse told me, don't Google, and I haven't. I sometimes get friends to Google, and if there's something that's worth knowing, they can tell me. But I don't Google. It's too
Okay.
dangerous. I
Okay.
think Googling would have you dead in the grave.
Okay.
Realistically, it's not
That's
it's not
interesting.
helpful.
Thank you. Thank you.